Welcome to Diabetes Primetime, everyone. In a recent survey on our Facebook page, 30% of people said their number one goal for managing their diabetes was to lose weight. So tonight, our guest is dietitian and CDE Danielle Aldous, who works at the Leaf Weight Management Clinic in Ottawa. And we're going to be talking with her about what's been shown to work for managing weight over the long run. Danielle, thanks so much for joining us tonight.
Thanks very much for having me.
So before we get started, folks, tell me where you're watching from tonight and what's on your mind. I'm so glad you've tuned in with us. So Danielle, you work every day with people who are trying to manage their weight. What would you say is the most common misconception or misunderstanding about weight loss?
I think a lot of people feel that they focus on food and fitness. And if those two things are not giving them the results that they anticipate, that somehow they're doing something wrong and that they are to blame or they're missing some secret ingredient that they need to bring into the picture. And we very much work to help people understand that although food and fitness are very much a part of the care process for weight, as with diabetes, that it is so much more complicated than that, and that there's so many more factors, some within our control and some beyond our control, that we have to consider.
So I think there are a lot of people with diabetes who've been trying to lose weight forever and not seen the success they were hoping for. And to your point, probably felt like it was their fault. If this is the case for someone watching at home, where might you recommend that they start in terms of approaching things differently?
Well, I think definitely a conversation with your family doctor, nurse practitioner, your diabetes care team. So if you have a specialist care team that you're involved with from the perspective of your diabetes, having a conversation with them about your concerns around weight is a great place to start because, certainly for people with diabetes, it can be a little bit more challenging to manage weight. And there's a lot of reasons for that. Some are related to just the nature of the metabolic change that happens with diabetes. But it can also be related to some of the treatment for diabetes. And so sometimes having a reassessment of your treatment can be a great place to start to look at whether or not there's any barriers there that might be, relatively easily modified to help with your progress towards weight.
So having that first conversation with our doctor, letting he or she know that, or healthcare professional, letting he or she know that weight is a concern for us. It's something that we're trying to take on and exploring together what might be the best approach from a medical perspective.
Absolutely. Especially if you've had diabetes for a fairly long time, the way that we think and think about and treat diabetes has really evolved and quite rapidly over the last number of years in terms of some of the therapies that we can use, which are more favorable when it comes to weight and may actually be helpful in managing weight. And so I think that's a great place to start.
Great suggestion. Okay, before we get any further, though, I want to do a trivia break, sponsored by Arcray, of course. If you answer tonight's trivia question, you will get some delicious diabetes-friendly summer recipes that our dietitian has put together. If you want some fresh meal planning inspiration for all that great produce coming out over the next few months, all you have to do is answer tonight's trivia question, which is, true or false, losing weight can help improve insulin resistance for many people. Is that true or false? Can losing weight help improve insulin resistance? Leave an answer for us in the comments, and just for answering, you will receive those delicious recipes delivered to your Facebook Messenger inbox. And trivia tonight is brought to you by Arcray. As your diabetes health ally, Arcray helps make diabetes management easy and affordable. Visit arcrayusa.com/cost to receive a free blood glucose monitor along with wellness materials to help simplify your diabetes management. Okay, Danielle, first and foremost, we got a voicemail from Sharon in Massachusetts asking about intermittent fasting.
My question is about fasting for people with diabetes. Can it be done? And if so, how do we adjust our insulin or our oral medications? Thank you.
So Danielle, let's talk about the first part of that question. Is intermittent fasting safe for people with diabetes?
We don't have a whole lot of concrete evidence to say a confirmed yes or no. So I think it does depend a little bit on your current treatment approach. So there have definitely been individuals who have diabetes who have had some success with intermittent fasting, but you do have to consider your medication therapy when you're considering intermittent fasting. we know that not just what you eat, but when you eat it can make a big difference when it comes to managing your blood glucose, and considerations in terms of your timing of your medications in relation to your meals is very important, especially with insulin usage. So when it comes to conversations about considering intermittent fasting, I really do think that those are ones that you want to have in conjunction with your care team so that they can help you to develop a comprehensive plan of how you might shift medications along with shifting meals. There's a lot of our clients through the clinic where I work that have tried intermittent fasting, and in particular have tried a form called time restricted feeding, which is narrowing the duration in the day in which you take your meals and extending the duration over which you fast. So they'll talk about it like opening the window of your eating and closing the window of your eating. And we do see that that can have a benefit for some people, but it has to be done in an informed way in terms of your medications. And there are limits to it. I get a little bit concerned about when people really shorten that eating window. So the current studies that have been done, not a lot of them are specific to diabetes, and few of them are actually in human models. So we're still looking to have data come forward as to how this actually looks. And whenever I'm having a conversation with people about whether or not intermittent fasting might be right for them, is to remind them that whatever we do to manage weight or diabetes, we have to consider that if it's working for us, we need to think about continuing it long term. So if it is something that maybe will work with your natural, what I call your factory settings. You know, if you're a person who naturally doesn't feel overly hungry for breakfast when you jump out of bed, maybe it does make sense for us to delay that a little bit and think about tightening up that eating window. And most of us, if you think about when we might struggle with less healthy eating or, find ourselves surfing the cupboards without any real true hunger or need to fuel ourselves, it's in the evening. And so that time restricted feeding approach tends to put a bit of a final closing of the window before often 8 p.m. or 9 p.m. I think it's still something we're exploring, but I think it is something that might have benefit for some if done in a considered way.
So, and I would just add to that, in terms of adjusting medication or insulin for Sharon and everybody, you always want to talk to your physician or healthcare team about that. And especially if you are making a drastic, if you're trying to decide to make a drastic change to your diet, definitely talk to your doctor. They know your unique health situation and the medications you're on. So they're really the best ones suited to do that. You always want to keep them in the loop. Folks, if you would like to have your question answered by an expert, call us at 904-414-5827. We listen to every single voicemail, and your question may be answered on our next show. Danielle, you spoke about something earlier that I want to pick back up on. You talked about changes that we make in order to lose weight need to be things that we can stick to over the long run. And I think that's particularly true with diabetes. Diabetes is something we're going to have over the long term. Can you talk a little bit about how someone might figure out what changes they can make to their diet or to their exercise regime that are really sustainable over the long term, something that they'll be able to stick to forever?
This is where we do a lot of self-exploration with people, and we ask people to be keeping some journals of their habits and behaviors and be aware of how their own environment influences their choices and how, their own mind comes into play in terms of nudging them in a positive direction or not. And everyone is unique. And so we really have to have that insight into what's going to work for you. And so that if you're trying out a habit, or a new habit, that, how does that feel? Does it feel like it's doable for you? Does it feel like it's something that you can sustain? Maybe with a little bit of effort. And we know that change is challenging. And so often when we are starting a change, it feels a bit uncomfortable. But, if you can be patient with it and work with it and try to see if that will kind of gel with you, then I think that is something that we look for. And so it's very individual. I have a whole host of clients who, some of them are finding techniques and strategies that they say, no problem, I could do this forever. Whereas another client will try it out and say, I can't do that, but I'm capable of doing something slightly different. So, I know for me personally, I've observed that when I don't have a healthy breakfast, I tend to be a late night muncher. And so for me, delaying or not having a breakfast just hasn't worked. And so I think it's be self-aware and really identify what feels right for you within the healthy guidelines.
All right. So speaking of breakfast, we got a bunch of very specific questions from people in our Facebook group about weight loss. So we'll dive into those right now. Our first question actually is from Mary, and she says, do I have to eat breakfast? So what would you say to Mary, kind of based on what we've just been talking about?
I don't like to work in absolutes. So, ultimately, again, it's a know yourself, right? And so I think I would get people to do a little bit of exploration on their own habits and sort of see, when I do have breakfast, how does that impact my hunger, fullness, my blood sugar control throughout the day versus if it is skipped. Because everyone's unique, and you really have to find the strategies that are going to work best for you. I have clients who will say, if I have a breakfast, then I find I'm hungry all day long and I'm like nibbling, and that is kind of defeating what I'm trying to do. Whereas others will say, if I don't start my day with a really good breakfast, then I do find that it comes back to haunt me later in the day. I'm nibbling and picking in the evening hours, and the kinds of things I go for are not great. It's long been a caveat of dietitians to say, eat your breakfast. But when we really take a look at, is that essential for everybody? I think you do have to kind of do that personal analysis. It's, you're not going to be doomed for a miserable diet if you find that breakfast is not for you. And so trying to make sure that you do get, nutritious foods in the rest of your day and meet your nutrition needs is still going to be important in your other meals.
Great answer. So Myra and Candy both want to know, can I have more carbs at one meal than I should and then have less per meal the rest of the day? And this is a super common question we hear a lot. So is that a good idea?
Yeah. It's a really interesting question. And because generally speaking, for blood sugar management, we are trying to identify the total number of carbs that are healthy for us and then try to divide those reasonably evenly over the day. So I think there are scenarios in which it might be possible to have a higher carb meal at one of your meals and then moderate the other meals so that you're still taking in an appropriate amount of carbs on the day as a whole. So kind of swinging towards one meal or the other. I think this is probably more possible for people who are not using insulin to manage their blood sugars. And as always, talking to your healthcare professional to ensure that the medications that you do take, insulin or otherwise, for your diabetes management are not going to put you at risk for lows when you are having those meals that are smaller in their carbohydrate load. So again, I think there's some individual questions there that would have to be asked about what are your medication management like? What's your activity level like? So I definitely know some athletes with diabetes who will swing their carbs a little higher at some meals, a little lower at others, while still trying to keep their total daily intake within the goals of what they're aiming for. Knowing your patterns around where your blood sugars tend to go throughout the day is also an important factor. So I definitely have some clients who will tend to front end load their day with higher carb meals and tend to keep the carb load a little bit lower at the end of their day, just based on their own blood sugar pattern. Having some insight into your blood sugar patterns is really helpful in making those decisions.
Exactly. Being a diabetes detective, using those numbers to figure out the answers to important questions.
Absolutely.
So Ruby asks, do I have to have snacks? And that's a great question, because I know a lot of people with diabetes here, you need to be eating 3 meals and 2 snacks. And people are, really wondering, like, what if I'm not hungry for a snack? Do I need to eat it? What would you say to Ruby?
I kind of agree with Ruby. I don't work in absolutes, which I know for some people is hard. They want to be told exactly what to do. But I do think that sometimes the messaging about snacks is a little bit overboard. Like I think we do want to do a check-in. We're trying to fuel our body well. So these are concepts that we use a lot in the weight management world, where we're doing a check-in and we're looking at why are we eating? Are we eating because it's in front of us? Are we eating because we're bored? Or are we eating truly because we need that fuel? And more often than not, we want to be respectful of when our body is asking for fuel and when it's not, so that I'm not taking in unnecessary energy if I'm not in need. Now, again, in the context of diabetes, taking our blood sugars into consideration there is important. So oftentimes, sometimes people are not aware of when they might be going a bit low in their blood sugars. So if you tend to be less aware of blood sugar low, then looking at planning to at least have a snack available in the event that you might test your blood sugars and they are low, or a meal is going to be delayed that you didn't anticipate. Having a snack available so that you're able to take in that nourishment in a timely manner and prevent any hypoglycemia because of that delayed meal.
That's a great point. So Lucy asks, kind of in follow-up to that, what are healthy snacks?
Generally speaking, we look to try to have a snack that's going to provide us with something that does give some carbohydrate, so fruit, or grain or vegetable, and partner that with something that will give us a little bit of protein or healthy fat. So the two together help to ensure that we're supporting a healthy blood sugar level and anchoring that to sustain us through to our next meal or snack time. So the carbohydrate, being a fruit or vegetable or starch, will help to sort of support a healthy blood sugar level. So if our blood sugars are waning because it's been a while since our last meal, then that'll help to support that and pick it up a little. And then having something like the nuts or seeds or cheese or yogurt or something along those lines to sort of sustain us. I personally really like some dried fruit, some dried apricots or raisins or cranberries or cherries mixed with some almonds or walnuts or pumpkin seeds. And in that case, it's not a large volume, but a small little baggie of something like that stuffed in your glove compartment or in your console can be a great thing. That if you do find that, you're on the go and you need a little something, it's shelf stable, so it can stay, there. And, if I forgot it today, it's still okay to have tomorrow. But, if you're at home, something like a little portion of cheese and a piece of fruit makes a great snack. There's lots of different combinations that you can put together, but that's sort of what you want to think about is fruit, vegetable, or grain, plus a protein or healthy fat.
I love it. All right. Susan asks, I need to do a short-term weight loss so I can get my hip replaced. And I want to know if that would be safe, talking about a 25-pound weight loss. Also, if there are medications for weight loss that are safe for people with diabetes. So Danielle, again, let's start with that first question, which is a great one. I know, if we might be told by a surgeon that we need to lose a little weight before we can safely have a surgery. How might Susan go about losing those 25 pounds in a way that's safe and sustainable?
So this is a situation in which we might try for a more aggressive weight loss for the purposes of making that surgery a bit safer and more effective for Susan. And yes, we do see that, especially for hip and lower body joints, that often when we are able to lose some weight prior to that surgery, it makes our healing and recovery process that much easier. Mm-hmm. So this is a situation, though, in which we might be leveraging some tools that are a bit beyond the self-care basics of, changing portions, changing quantity in meals, and stepping up exercise. And certainly if she's requiring a hip replacement, she's probably limited in the types and quantity of exercise that she can do. So this is a place where in a clinic like where I work, we might be leveraging some partial meal replacement. And we also might be utilizing some medications that are very helpful for weight. And working with the surgeon to identify what are some reasonable, doable weight goals while maintaining good nutrition in preparation for that surgery.
So what I hear you saying is go find, a clinic that specializes in sustainable, safe weight loss, and they can really help you kind of beyond, give you that additional support and tools beyond kind of the DIY. I just need to knuckle down.
I think so, especially in the context of if Susan does also have diabetes. This is, we're talking about something that is going to require some more specialized therapy here, especially in that more acute, short term. We've got a bit of a timeline around this type of nature, and that does require some medical supervision, often by a physician who's specialized in diabetes care and or weight care. And so that I think is a little bit more unique situation. Definitely can be done, but I think does require that a bit of a specialist healthcare team.
So for those of you who have just joined us, we're here with dietitian and CDE Danielle Aldous, talking about how people with diabetes can reach a healthier weight. And in case you missed it earlier, we are giving away some delicious summer recipes to anyone who answers our trivia question tonight. So in case you missed it, that question is, true or false, losing weight can help improve insulin resistance for many people? Put your answer in the comments and you will get those recipes. So Vincent asks, healthy suggestions for an African or Indian traditional diet. And while we don't have enough time here to get into specific cuisines, I did want to ask you, are there resources that you would recommend for people of different ethnicities to find healthy recommendations for their traditional foods?
Yes. And I have a specific one that I will send your way and you can share. So I'm a Canadian dietitian, and Dietitians of Canada has an excellent resource online called unlockfood.ca. And on unlockfood.ca, there's all kinds of great healthy eating resources, some that are specific to diabetes. And in fact, there is some recommendations around recipes and strategies to keep your meals healthy for blood sugar control if you follow a Pakistani, South, North, Indian, regardless of the type, and some of the Afro-Caribbean traditional meal patterns too.
Anita says, initially in the pandemic, I was consuming higher carb foods due to economic reasons and also just what was available. Now it's improved a lot and I'm able to plan better again, but prices for fresh produce have skyrocketed in Vancouver. A great question. I think something a lot of us have experienced. Are there any suggestions you have for people who are trying to eat those healthy fruits and vegetables but are struggling financially? And how you might suggest we go about that?
It's a great question, and it's been coming up a lot since the start of the COVID pandemic, for sure. I think widening our understanding of healthy food. We do tend to get kind of focused on fresh, and we forget about the benefit of frozen and canned as well. And frozen, generally speaking, may actually have some nutritional advantage because it's picked at the peak of its freshness. It's quickly frozen. Freezing does not negatively alter the nutritional value of foods. And in fact, it helps you reduce some waste because you're getting vegetables and fruit that are chopped and peeled and ready to go. Canned often gets a bad rap, but I think more and more there's a lot of variety that is less salt added in the canned foods, and so people are reconsidering the fact that they start off they buy some fresh to start off their grocery interval, some frozen, and maybe even keeping a couple pantry staples of some canned goods that can easily be, thrown into stir fries, thrown into chilies, thrown into soups, and still give you that benefit of lightening up the carb load in your meal and providing a real nutrient density to your dish as well.
So if we were going to peek into your pantry, Danielle, what would be 4 or 5 veggies that you always have either canned or frozen on hand? What would be some good suggestions for people to start?
I have frozen green beans, frozen peas. I have frozen avocado cubes, frozen mango, frozen berries. So those are sort of staples that we keep in our freezer. We also tend to, when our bananas are starting to get to the end of their life, we peel them and wrap them and throw them in the freezer so that they're easy to toss into a smoothie. And thinking about my pantry, I definitely have varieties of canned tomatoes, canned beans like kidney beans and chickpeas, even some canned corn, and again, some canned green beans and that sort of thing and some canned fruits as well, packed in water, things like pineapple and mandarin oranges, which are great to throw into a salad or have as a snack as well.
Before we go, is there anything, you see patients all day long. Is there anything you wish people with diabetes knew about weight loss or healthy lifestyle change?
There's often been maybe some confusion about how to understand the basics of carbohydrate versus fat versus protein, kind of putting it in very practical terms for people, seeing what they do know, and certainly people are very knowledgeable, but there may be some missing pieces, just little gaps that sometimes can be the little switch of a light bulb that makes them go, oh, I get it, So we're often using food labels and food models and looking at food records and comparing that to blood sugars and really starting to make the connection so that people can see the power that they have in making some food changes, very subtle often, food changes or fitness changes that really can influence what goes on with their diabetes management, but also with their weight management. So sometimes the way we think about or understand the disease has changed. And if it's been a while since you've had a check-in or, maybe attended your diabetes education center for a refresher, sometimes we lose sight of those important things that we can do on a daily basis to just improve our insulin resistance, and certainly understanding that it's not easy. So we really do work to try and find what's most important to our clients and where they can make those small behavior changes to move their self-care in a positive direction.
Small changes can make a big difference over time is one of the things I hear you saying, which I think is great.
Absolutely.
Wow, this has been such a helpful show, Danielle. Thank you so much for sharing your very practical suggestions with us. We will have you on again, but we so appreciate you're just always so helpful and just down to earth. So thank you.
It's my pleasure. I really enjoy doing these shows with you.
And here is the answer to tonight's trivia question, folks. True or false, losing weight can help improve insulin resistance for many people. It is true that a little weight loss can make a big difference for insulin resistance for many folks. Another reason to put all of Danielle's suggestions into practice. We will be back for another interview with an expert on July 28th at 8:30 p.m. Eastern Time. We'll be talking with diabetes care and education specialist and exercise expert Michael C. all about exercise, setting goals, and celebrating successes. I hope